A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a shocking turn of events, Susan Monarez, the recently appointed director of the Centers for Disease Control and Prevention, CDC, has been ousted from her position after less than a month in office. This swift termination has raised eyebrows across the political spectrum, particularly as it appears to be tied to her refusal to align with certain political directives regarding public health. Monarez's departure was confirmed by the U.S. Department of Health and Human Services, HHS, which issued a brief statement thanking her for her service. However, her attorneys, Mark Zeid and Abbe David Lowell, have vehemently denied that Monarez resigned or was fired, claiming that she was targeted for prioritizing scientific integrity over political pressure. When CDC Director Susan Monarez refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. For that, she has been targeted, the attorneys stated. This incident is not just about Monarez. It represents a broader issue of the systematic dismantling of public health institutions and the silencing of expert voices in the face of political agendas. The lawyers warn that this attack on Monarez serves as a dire warning to all Americans. Our evidence-based systems are being undermined from within. Monarez's ousting coincides with the resignations of several other top CDC officials, including Dr. Deborah Oury, the agency's deputy director, and Dr. Demetra Daskalakis, head of the National Center for Immunization and Respiratory Diseases. These resignations have been attributed to rising health misinformation, especially regarding vaccines, and the politicization of public health. Oury, in her resignation letter, expressed deep concern over the crippling effects of planned budget cuts and the ongoing changes within the agency that prevent effective leadership. She lamented the alarming rise of misinformation about vaccines during the current administration, emphasizing that the science at the CDC should never be censored or subject to political interpretations. The fallout from Monarez's termination and the subsequent resignations raises critical questions about the future of public health leadership in the United States. Experts worry that the loss of experienced professionals at the CDC could have devastating consequences for the nation's health security, especially in a time when misinformation is rampant. The CDC, which has long been regarded as a cornerstone of public health in America, is now facing a crisis of confidence as it grapples with the ramifications of these recent events. As the political landscape continues to evolve, the implications of Monarez's ousting will likely reverberate through the public health community and beyond. The situation highlights the tension between scientific expertise and political influence, a struggle that could shape the future of health policy in the United States. As we await further developments, one thing is clear: the integrity of public health institutions is under siege, and the fight for evidence-based science and policymaking has never been more critical. In the coming weeks, we will continue to monitor the situation closely, providing updates as more information becomes available. This story serves as a reminder of the importance of protecting our public health systems from political interference and ensuring that experts are allowed to do their jobs without fear of retribution. The American public deserves transparency and accountability in health leadership, and it is incumbent upon us to demand that our institutions uphold these values. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.